I grew up in a traditional family, and my parents and I decided that I should become a nutritionist. But as I was taking the nutrition courses, I also had to take very heavy science courses like biochemistry and chemistry. And I started to realize I really love science and had many friends that were going into pre-med, and I decided I do want to become a doctor and try to help my patients through nutrition and see what being a doctor is all about. So when I actually went into practice in internal medicine, I noticed patients were on a lot more medicines than I really learned in college and med school. And I really wanted to see if I could get them off some of these chronic medicines. And one time I had a patient who was very, very overweight, and he heard about a drug combination that could help him lose weight. And I researched it, and I started researching more and more about the field of obesity. And I thought, wow, if I could get them to lose weight, I could probably get rid of some of their medicines and reverse their diabetes and their high blood pressure. And he was my first patient. I still remember his name was Bill, and he did phenomenally. He lost like 80 pounds, and we did get him off his diabetic meds. And so I realized, wow, this is so much fun. I'm enjoying seeing people get healthier instead of each year needing another medicine, as they seem to get a little worse and gain a little weight each year. So after I realized that weight loss was helping my patients, I decided to get board certified by the American Board of Bariatric Medicine. And I learned so much about the hormones involved, hormones such as ghrelin and leptin that play a role in hunger and satiety. And I decided actually to open a weight loss center, still using my internal medicine knowledge, but really focusing on the weight loss. And I found it did attract many patients who were so hopeful to lose weight, and their regular doctors weren't really interested in helping them. So today we have 2 clinics. We started in Lutz, Florida, and I was there for many years, and I saw that there was a need for my services in a bigger area of the Tampa Bay zone. So 4 years ago we opened our practice in St. Petersburg, Florida, and it's really been exciting. I feel like we're really helping many more people across the Tampa Bay with weight loss, and even expanding our treatment strategy with bioidentical hormones and anti-aging medicine and functional medicine, as well as peptide therapy. So it's very interesting when I look back at the medical world and how I had to treat patients in the 1990s and 1999. We really had limited ways to help people with weight loss. We had appetite suppressants, and my colleagues and I had to be very creative. We used to have to look for other medicines that had a little weight loss attached to them, such as Topamax and Wellbutrin. And all these modalities did help patients, but not to the extent of some of these newer treatments that we do have today, including a magnificent treatment called semaglutide, which has really been a true joy to my heart to see patients losing weight. And this drug is helping them internally. It's helping lower fatty liver, it's helping lower cardiovascular disease, and it's definitely helping lower the onset of diabetes or reversing diabetes. So this new peptide therapy world is just so exciting. And I used to tell my patients, one day we're going to have a shot that helps you and cures your obesity. And I feel like we're getting closer and closer to that, because it really has become true.